Diabetic ketoacidosis is a serious complication of diabetes that occurs when your body produces high levels of blood acids called ketones. The condition develops when your body can't produce enough insulin. Insulin normally plays a key role in helping sugar, glucose, a major source of energy for your muscles and other tissues, enter your cells. Without enough insulin, your body begins to break down fat as fuel. This process produces a buildup of acids in the bloodstream called ketones, eventually leading to diabetic ketoacidosis if untreated. Hyperosmolar Hyperglycemic Syndrome, HHS, is a condition characterized by the presence of hyperglycemia, hyperosmolarity, and dehydration. There is enough production of insulin to reduce ketosis, but not to control hyperglycemia. Persistent hyperglycemia causes osmotic diuresis, which results in the fluid and electrolyte imbalances. Signs and symptoms. Diabetic ketoacidosis signs and symptoms often develop quickly, sometimes within 24 hours. These signs and symptoms may be the first indication of having diabetes. You may notice excessive thirst, frequent urination, nausea and vomiting, abdominal pain, weakness or fatigue, shortness of breath, fruity scented breath, confusion. More specific signs of diabetic ketoacidosis, which can be detected through home blood and urine testing kits, include high blood sugar level, hyperglycemia, high ketone levels in your urine, hyperosmolar hyperglycemic syndrome, increased thirst and urination at the beginning of the syndrome, feeling weak, nausea, weight loss, dry mouth, dry tongue, fever, seizures, confusion. Risk factors. The risk of diabetic ketoacidosis is highest if you have type 1 diabetes, frequently miss insulin doses. Uncommonly, diabetic ketoacidosis can occur if you have type 2 diabetes. In some cases, diabetic ketoacidosis may be the first sign that a person has diabetes. Hyperosmolar hyperglycemic syndrome. A stressful event such as infection, heart attack, stroke, recent surgery, heart failure, impaired thirst. Diagnosis. Risk for fluid volume deficit, risk for infection, deficient knowledge, imbalanced nutrition, less than body requirements. Management. One of the main goals of treatment of DKA involves correcting high blood glucose levels by injecting insulin as well as replacing fluid lost because of vomiting and urination. The main goal of HHS treatment includes correcting dehydration, which would improve blood pressure, circulation and urine output. Pharmacological. Rapid-acting insulins, for example, insulin aspart, insulin glucoside, insulin lispro. Short-acting insulins, for example, regular insulin. Electrolyte supplements, for example, potassium chloride. Alkalinizing agents, for example, sodium bicarbonate. Nursing management. Diabetic ketoacidosis. Assess skin for dehydration like poor turgor, flushing and dry mucous membrances. Observe for cardiac changes reflecting dehydration, metabolic and electrolyte, imbalanced tachycardia, hypotension, weak pulse ECG changes including elevated P wave, flattened T wave or inverted and prolonged QT intervals. Assess respiratory status, cusmeal breathing. Acetone breaths characteristic of metabolic acidosis. Assess gastrointestinal symptoms like nausea, vomiting, extreme thirst, abdominal, bloating, cramping, and diarrhea. Genito-urinary symptoms, noxuria and polyuria. Neurologic signs, crying, restlessness, twitching, tremors, drowsiness, lethargy, headache. Stabilize the patient's airway, breathing, circulation. Obtain 16-gauge Roman 4 line on both sight and assess cardiac monitoring and pulse oximetry. Monitor serum glucose hourly and urine ketone. Monitor basic electrolyte, osmolarity and venous pH every 4 hourly until patient is stable. Determine and treat any underlying causes of DKA, for example, pneumonia, UTI and MI. Hyperosmolar Hyperglycemic Syndrome. Monitor blood glucose levels. The hallmark of HHS is extremely elevated blood glucose levels, 600 mg/dl. Encourage optimal hydration and administer IV fluids, normal saline, to maintain fluid balance. Excessive urination can cause dehydration. Encourage oral fluids as tolerated and administer IV fluids to re-establish tissue perfusion and maintain electrolyte balance. Insulin regular infusion to reduce blood glucose level. Monitor for hypokalemia. Monitor blood glucose levels and serum potassium. As insulin is administered, potassium is lost. Initiate potassium supplementation as necessary. Frequently assess level of consciousness and mentation. Brain is an insulin-dependent tissue. With elevated glucose levels, there is not enough insulin to normalize and the patient becomes confused, dizzy and may have changes in level of consciousness. Patients often experience drowsiness. Monitor for hypothermia and treat with antipyretics, fever reducers. Cool compresses and cooled IV fluids. Thermoregulation is impaired as urine production decreases, sweating decreases and electrolytes become imbalanced. Monitor vitals for hypotension and tachycardia, most likely related to dehydration and hypovolemia. Patient is at risk for hypovolemic shock. Educate patient on disorder. Always important to educate patient throughout and give them resources they can use when at home.